Hello everyone, welcome to TalkingHealthWithDrLaz, your favorite health program on television. It's a few days to Christmas and I know many of you are excited. It's been a long year and we thank God for bringing all of us to this point of the year, and we can't wait to see you end the year in a strong note and move on to the new year. Of course, we are reaching you as usual from Nigeria's capital city, Abuja. My name is Dr. Laz Eze. Today we are going to discuss a very important topic, that affects everyone. I will be talking about burns. Yes, burn injuries. And of course, you know that this time of the year, the dry season, the harmattan period, is a period that will have a lot of wildfires and burns within the environment. And also a lot of festive activities, a lot of cookings, and so many movements involving vehicles and all of that. So it's that time of the year that in hospitals, we tend to see more cases of burns than even compared to some other periods. So, and with me to discuss this is a specialist on this field, a plastic and reconstructive surgeon. So, and we're going to be deep diving into a discussion after the break. I will use the video wall, project some images. Let me warn ahead that some of the images you might find it very disturbing or uncomfortable, but we are using it essentially for educational purposes. Please do stay with us after the break. We'll be right back.
Dashing through the snow in a one-horse open sleigh, over fields we go, laughing all the way. Bells on bobtail ring, making spirits bright. What fun it is to ride and sing a sleighing song tonight! Oh, jingle bells, jingle all the way. Oh, what fun it is to ride in a one-horse open sleigh! Hey, jingle bells.
Welcome back to Talking Health with Dr. Laz, your favorite health program on television. Already with me in the studio is Dr. Chijioke Chukwuma, who is a plastic surgeon at Gariki Hospital, Abuja. You're welcome to the program.
Thank you very much, Dr. Laz.
Yes, talking about prevention and management of burn injuries. What is it like in Abuja? Is it something that is very common, having cases of burns?
First of all, thank you for inviting me to this show to talk about burns, which is a topical issue, especially this season. We're in the season of burns, usually during the dry season, where there is more fire outbreaks, more people want to use hot water, and there's actually more hot water burn. Burn is actually a preventable event. There is need for this campaign, which we're doing now, to prevent burns, because it's a preventable event. The occurrence of burn is actually very debilitating.
Yes.
Debilitating, yeah, the effects on the community and on the patient. Especially now we see a lot of them coming, and more or less is more frequent among the low and middle class population. Income people.
Right.
Yes, and again, the cost of managing this burn is quite exorbitant. Quite exorbitant. It can really drain.
So, in other words, the poorer people are, the more cases of burns, and even more expensive it can be to manage. So let's quickly look at the slides on the causes of burns injuries. So what the slides comes on, so what are the common causes of burns?
Okay, well, there are several causes of burns. The commonest usually is the hot water burn, what we call as scald injuries.
Okay, hot water.
Hot water, hot fluid, hot oil.
Okay.
This is the common. It's common among children because,
right.
they tend to be more adventurous, and this is one of the easily preventable causes.
Okay.
The other causes are chemical injuries, where people...
What are examples?
Example, caustic soda, people who make soaps, who make soaps and other detergents.
Right.
And also industrial use of chemicals, okay, acids, alkalis. Okay. So exposure to these chemicals can actually burn, and they could be quite severe.
Wow.
Quite severe. Another cause is hot objects. Hot objects. Maybe hot iron when somebody leaves it on for a long time, and then another person unknowingly touch it. So you really had contact burn. Also, we call it contact burn too. Flame burns is actually significant.
The obvious ones that
the obvious one people get. Yeah, building. Yes, yes. A lot of that. And recently we had one explosion in Abuja, flame burns. So it can be quite terrible. Yeah, and it's the severest of them. Electrical burns. Yeah, this is also preventable, especially in home setting where appliances are poorly connected or children tend to play with cables.
And fake cables.
Fake cables, yeah, yes, yes. Ideally,
like
people.
all these market bonds that we get to see.
Yeah, exactly. So, when you use fake cables or when you try to do some of those repairs at home, connections. So it's better to involve an expert when you have chemical appliance. Electrical appliance issue. The radiation burn is though uncommon, but we see it sometimes in the hospital when there is a radiotherapy. Sometimes you have sun exposure, so significant sun exposure leading to burns. Though not common in this environment because our skin has a lot of production from the melanin, but it's more common outside.
Are there other causes? Perhaps not listed there.
Well, another categorization of burn could be accidental burn, where it's an accident. It happens by chance. You accidentally hit a hot object, or another one is non-accidental burn. We call it abuse. When you see a child coming to you with a detailed pattern of the burn, it follows a regular pattern. Burn is an accident, so it doesn't follow a regular pattern. But when you see a child coming to you and the burn area is well demarcated, sharply demarcated, one begin to suspect that it looks like it's a deliberate act. So when we see such, we try to call the necessary organizations to look into that. Another cause of burn could be from suicidal attack, suicidal tendencies, attempts where maybe people who are heartbroken or people who
for various reasons.
Yeah, for various reasons.
Management of mental health and
exactly. So they inflict injuries on themselves and then cause burn on themselves. Sometimes it could be flame. Sometimes they try to drink the chemical liquids and then cause burn in their
internal organs. So we already have prevention, and I think this is where we spend more time, and we have to do that very quickly because time is already ticking. So prevention of burn injuries, what are the key points from homes to offices to the entire environment? So never leave times cooking on the stove unattended. Prevention
to me is the hallmark of this campaign, of this education is the keystone in prevention of burn. Talking it over and over again to emphasize it in the schools, in the churches, in health centers, to make sure that this avoidable incident burn is avoidable. Now, coming to the first one, sometimes one may leave a cooking pot on the stove and maybe get distracted by the television show or some other errands, and then
especially all those addictive programs.
Yeah, so you want to finish up the program at and unknowingly you forget that something is burning on the stove. So the burn can become flame, and it can, the burn can just happen.
Let's get to the next one quickly. The pot handles toward the rear of the stove.
Yeah, when you're cooking, it's better to keep the handle away from you so that you don't accidentally hit the handle, and then the whole thing can turn on you and pour on your body. Then don't carry child. You don't carry child to the kitchen.
So kitchen out of bounds. Out of bounds
for children.
Not a playground.
Not a playground. Children should be off from kitchen at all time.
Yeah.
And then when you go to the kitchen, when you want to cook, you don't wear loose fittings, whether long clothing that maybe while turning the food on the pots, the clothing can get inflamed, or maybe long wears that can easily get burnt, unknowingly. Avoid cooking with stove on the floor. When you put the stove on the floor, it can accidentally kick it
So where is it
without
supposed
knowing.
to be?
It should be on a table. A
right.
table, just at a chest level or your waist level, so that you can have control.
Okay.
And unplug iron and similar devices when not in use. So if such devices are left for a prolonged period of time, the heat from the connection can melt the cables, and then you start having short circuiting, and that can lead to sparks and burns. Then placing children on hot seats. For instance, when the weather is hot, inside the car can be very hot, and when you try to strap child inside the car and the seat is very hot, you will actually get to see that. Few occasions though, but you just see a mark from the strap on the seat and in the car.
Okay, so I think, we continue with that of prevention. What about workplaces, industrial places? What are the do's and don'ts?
Okay,
or even offices?
Yeah, in workplaces, prevention of burn starts with the structural building.
Okay.
There are things that architecturally should be in the building to prevent burns, and if it does happen, there are devices that should detect it early. For instance, buildings these days come with spray, water spray. So whenever there is smoke, which is detected by the smoke detector, the spray,
will be activated.
So the water sprinkles all over the building, inside the building, to quench the fire.
Right.
And again,
and the experts in building already know some of these.
Yes, there are also alarm system that also detects and triggers of the alarm. So people in the building, then there should be drills from time to time in public buildings where, okay, if there is fire incidents, this is the exit. This is, okay, when everybody goes, we call the fire, this is the number to call. And then when everybody leaves the building, there should be a head count. It's okay, we are complete, nobody's inside. Then there should be this drill should be from time to time, so that when the actual thing happens, you know what to do at a particular time to prevent panic.
Okay. What about the presence of fire extinguishers?
Yes.
Which locations should it be? Both homes and public buildings as well?
Yeah, fire extinguisher is very, very necessary in homes, car, and then in public places. And it should be a strategic and easily accessible.
Right.
Strategic and easily accessible places where the first person that gets to it should know how to use it. So that's part of the drill. Training people on how to use it, is also part of it.
All right. So there's a whole lot of other do's and don'ts listed: keeping chemicals out of reach of children, and not just children, even adults as well. Some actually look like water, So if there is no sign or warning, you could have somebody just go and grab a chemical and begin to drink.
Exactly. The prevention is quite, prevention of burn is quite large, okay? For an instance, children, when you want to take your bath in the morning, you don't need to take the hot water in the bucket to the bathroom. Rather, you take the cold water from the bedroom to the kitchen and pour the hot water, because while taking the hot water to the bathroom, you can have spills.
Yes.
Children are moving up and down.
Someone could just run to you from the back,
and it happens. So, and then when you want to do tea, you put the cold water. Don't make it too hot, because a child can try to grab the cup on the dining and the thing spills on the child. And then appliances, electrical appliances, try and keep it away from children. We have instances where children tend to put anything they see in their mouth. So they put the raw cable in their mouth and they get electrical burns in their mouth and then in their hands, because they try to experiment.
I see a lot of that, especially when they see those lights.
Exactly.
They get attracted by the lights.
Yeah.
Maybe you even plug your phone or something, they get attracted and they go towards it.
Exactly. So appliances that look like toys that are flashy, let's go apply, because the children want to grab those appliances that are shiny, and then they can also get burnt.
Okay, so a whole lot of preventive measures for burns. Right there on your screen, you can take a screenshot of it and take your time to go through it. But we're going to take a break right now. When we return, we'll talk more about the care and other things you need to know about burns. And of course, some of the complications, things that may likely happen when it's not properly treated. Do stay with us, we'll be back shortly.
Dashing through the snow in a one-horse open sleigh. Over fields we go, laughing
welcome back to Talking Health with DrLaz, your favorite health program on television. Yes, I've been discussing issues around prevention of burn injuries with a plastic surgeon here in the studio. And we've talked about various preventive methods and, of course, the causes of burns themselves. So coming back to you, Dr. Chukwuma, so how do we care? What are like the first aid, the first thing someone should do when there's a case of burns? Okay, maybe before we go to the care of burns, there is the superficial, the deep, and all that. That's level of categorization. We want to speak to it briefly before we get to this care, because I believe some of the strategies for the care is based on some of these categories. Okay,
well, categorization of burn based on the depth of the burn injury. You know, it could be first degree, which is negligible. You just see redness in your skin. It could be second degree superficial burn, what's called partial burn. Okay, could just be in the first part of the dermis where you see blisters and it's painful. You know, then the deep partial burn, you know, is also painful, but it looks more, it looks pale. It looks pale. It may not have the blisters like in the other one. Then the deep burns, deep dermal burns, is usually painless. That's burn down to the subcutaneous tissue.
Okay.
Okay, so it's usually painless, and then it's actually more severe.
Wow.
Than the other.
So what you're saying is, if someone has burns and is rolling on the floor, on the ground, shouting out of pain, is actually a suggestion that is not very deep on the skin. But if there is burns injury and you're not feeling much pain and all that, it suggests that it's a deep burn.
Yeah, at the time of occurrence.
At the time it occurs.
Yeah, but with time, as the deep burn begins to, you know, the nerve, you know, what actually makes the deeper burn painless is that the nerve endings are burnt. So you get to feel less pain. But for the other, you know, partial degree burns, you know, it's not so deep. It's just at the dermis, where you also have a lot of nerve endings. So it's actually quite painful.
Okay.
Quite painful.
Okay, so right now we could go to the care first aid. What should someone do when a case of burn is noticed? Okay,
well, the common thing people do when they get burn is to panic. You know, it's an accident, it's an unexpected event. Right. So there's a tendency to panic. And in the midst of panicking, one might begin to do a lot of things, and they follow a lot of suggestions, you know.
But I know in emergency situations, almost everybody becomes an expert.
Everybody, yeah, and then you can get a wrong opinion, and then people sometimes buy into those wrong opinions. Right. So, but it's important that you do the right thing. Now, the first thing you do has a lot of impact in the burn, on the burn injury. Subsequently, subsequently, if you do the wrong thing, it's going to affect the outcome of the burn at the time it occurred. For an instance, the best thing to do when it happens is to pour, whether if it's hot water burn or flame burns, or even chemical burns, okay? Pour a lot of water, tepid water. You know, some people say cold water. No, just tepid.
What is tepid?
Tepid water is just simply water you can drink.
Okay,
it's not
so
too
is it
hot.
Room temperature?
Room temperature. Room temperature is not hot.
Well, this is our big drama.
So it's not hot, it's not cold.
Yeah.
Okay, yeah, you're going to pour it till the pain starts subsiding. Okay. Pour it till it starts subsiding. Then, again, avoid applying things that can worsen the burn. We've had instances where people apply raw eggs, pap, palm oil, honey, and a lot of things. So all these things would actually increase the chances of the wound getting infected, and then worsens the outcome of the burn.
Okay, so let me emphasize that when there is burns, the most important thing you have to do, as much as possible, he has said it, but keeping it away from infection is something that is very important, because when it gets infected, it can cause so many other things, delay wound healing, you know, make it more likely to have complications. And you may have a chronic, you know, ulcer or injury that you'll be treating for a very long time. So that takes us to the other slide on care for burn injuries, which is a bit more technical, but you could just pick through it very quickly. Then we'll talk a bit more about the complications, then run it up.
Okay. The care of burn injury, first of all, we need to decide which person needs to be admitted and which person does not need to be admitted. So once you have a burn injury, it's good to present to a healthcare personnel that is knowledgeable about burn care. So first of all, if the burn injury is not so severe, usually less for children, less than 10% surface area, for adults 15%, you might treat at home, okay, or treat in a center that is not a designated burn center. Also, if the burn injury is deep, you would prefer treating in the hospital.
I think what's important to the public is you have burns, go to the nearest primary health care, because some of these decisions of deep and severe, not severe, might not be one that, you know, laymen might be able to make. So, but if you have burns, you know, it's just best that you take the measure of the first aid you talked about, you know, and you could go to a primary health care, either for treatment or further advice or referral on what to do.
Exactly.
So these we may not go into details. There are things that each of them is a topic on its own.
Exactly. So it's quite,
you know, so it's a topic on its own. But you keep to that nutrition, prevention of infection, wound dressing, and all of that. A large spectrum for care. So, well, let's see a bit more about possible complications. You know, so for burns that may happen, what are potential complications, especially if it's not properly managed?
Okay. One of the commonest complications of burn that actually leads to bad outcome is infection. Infection, at all costs, you want to avoid burn wound infection. Okay, because the burn wound infection will actually deepen the bones and makes it longer. Makes it take longer time to heal.
Right.
And even when it heals, the scar becomes very, very unsightly. Okay, there are other complications.
We are looking at one right now. Could it lead to this scar? This is hypertrophic.
Yeah, this is.
Or keloid scar is you know, the scars has taken over the entire.
Yeah, this is as a result of poor management of burns. Okay, you can see this child's hand is bent over this way. That's the palm.
Yeah.
So it's bent over from the pool of the burn scar. You can see the whole hand covered with scar and pulling on the hand. So the hand is,
even the face.
And even the face. So a lot of deformity here.
Right.
And a lot of time this is preventable. This deformity.
I can see contracture here.
Yes. So the child can't
be able to.
The child can't move the palm. He can't move the elbow. And even the face, you can see the baldness, the eyes, and so the hand is actually deformity, actually preventable. That's why it's advisable to go to a burn specialist, a burn center. Okay?
Not resorting to self-help.
Not resorting to self-care.
There's a previous slide with some chronic ulcers on the hand. Can we look at that, please? Yes, you know, so I was involved in the management of this patient actually. So, and series of surgeries had to be done. Can this be a complication of infection? Can it lead to this as well?
Well, chronic burns. Well, if for an instance, depending on the depth, like we talked about before, if the burn is deep, it takes a lot of time to heal, and it might take months to heal.
But do you have a situation where a superficial burn can become deep?
Yes, like
or can even lead to chronic ulcer?
Yeah, exactly. Like I said, you know, once the burn wound gets infected, it gets deeper and it might become chronic.
Okay.
Okay, once it gets deeper, it takes a longer time to heal.
So what this means is a simple superficial burns can actually get to this if not properly
managed in terms of preventing infection and early adequate resuscitation.
So for this kind of patient, what will you do for the patient? Please go back to the one with, for what can be done for this patient?
For this kind of patient with this burn on the hand, you can see this is actually, okay, like you said, you managed this patient before. it looks like this is, a patient is actually in theater. You can see some metals. Okay, this is actually a reconstructive surgery for a burn patient.
Right.
The patient actually had a contracture. Yeah. So this is actually a contracture release surgery because you can see a bridge here, normal skin, which is over the joint.
Right.
So skin graft, usually skin graft the adjacent raw area
Okay.
to cover the wound.
So skin grafting could take from
The thigh, or from any other part of the
any
body
other part,
that is spared during the burn process.
Okay, so much we've talked about, and we're really out of time. So the policies and all of that, just in 60 seconds. So what should be done to make sure that, apart from the enlightenment and awareness creation, are there policy issues that is relating to burns management that you want to speak about?
Okay. First of all, burns needs a lot of policy backing to help in the management of burns, starting with training of health personnel, education of health personnel,
especially at primary
down
healthcare
to
level.
the grassroots in management of burns. Okay, the training should go, because you know a lot of burns happen deep down in the village.
Right.
Like they may not have access to burn centers, so training them will help. Secondly, you know, insurance. Burn care is expensive. So
training, insurance, move to the third.
Oh no, the third one, there should be a synergy. For instance, if there is burn disaster, you know, there should be a synergy down the different cadres of government to assist in those disasters. You know, not common in our environment, but there could be that.
We are really out of time. I know there's this society that
there is Nigerian Burn Injury Society, which comprises of doctors and other health personnel, you know, that try to campaign against burn injuries. Yes.
I really thank you for making our time to join us on this program. I know there's so much you want to talk about, but definitely one program will not be enough. But I think for anyone that is watching, you know, the prevention methods is essentially in our hands, and it begins from our homes, our offices, and everywhere we work. And please, bush burning this season, avoid it, because you may never know what it will lead to. It could be your loved ones, it could be anybody that will be affected. So thank you very much for being with us today as we talked about burn injuries. Merry Christmas, and I'll see you same station, same time next week. My name is Dr. Laz Eze. Bye for now.